Good afternoon. I'm Scott Harrow with the UMHS Alumni Association, and today we are speaking with Dr. Melissa Alvarez, a 2017 graduate and certified physician. And Dr. Alvarez, I want to thank you for speaking with us. And can you please just
Thank
tell
you.
us a little bit, thank you. Can you tell us a little bit about your new position as Chief Cardiovascular Disease Fellow at Danbury Hospital in Connecticut?
Sure. So I'm currently in my final year of my general cardiology fellowship at Danbury Hospital in Danbury, Connecticut, a site that a lot of UMHS students may be aware of. We do psych there, so that's kind of how I knew the hospital existed. So as the chief fellow, my job is basically being like the manager of all of the fellows. I'm in charge of making everyone's schedule, if someone calls out, finding coverage, kind of setting the educational curriculum. And basically, I'm kind of the liaison between the fellows and our program director and faculty, and kind of, tweaking things with the fellowship and, bringing up concerns we have, bringing up faculty concerns to the fellows. It's more administrative, but it's a good role to learn that kind of side of medicine because in the future, no matter what job you get, you have to deal with administration, you have to deal with nurses and everything. So kind of learning to do that administrative piece has been interesting.
Okay, great. And you are also a fellow in training, leadership director of the Young Scholars Program at the American College of Cardiology. And can you please share some of what this involves?
Sure. So the American College of Cardiology is the big national US group for all cardiologists across the country. And as part of their diversity and inclusion initiative, they started the Young Scholars Program. This is a program that takes high school and college students and kind of immerses them into the world of cardiology. So last year was the first year that I had the opportunity to volunteer with this group. And basically what it entails is we have a group of fellows that puts together programming for these students every week. We teach them nuts and bolts about cardiology. What is an EKG? What is the anatomy of the heart? Because they're high school, college students, so we try to get down to their level. We also had the opportunity to put together a camp for them. So they got flown to the headquarters of ACC, which is in Washington, D.C. And we had a pathologist come in and show them actual hearts and various disease states and what normal is. They got to echo each other with like some echo probes on an iPad. So it's been really fun. So this year they kept me on and one other fellow, and we are kind of in charge of the team of fellows this year and kind of guiding them into, this is what we did last year. These are the educational programs that worked. This is what didn't work. So it's been really fun being able to be a part of that program. A lot of these kids are underrepresented in medicine. The fact that they get to go to DC, like some of them have never flown on a plane before. Some of them have never stayed in a hotel. So being able to be a mentor to those kids has been great. And seeing how smart, I don't know if I get into med school now with some of the stuff these kids are doing. They've published papers, they've been presenting places, they've been volunteering. So it's actually really inspirational to get to work with them as well. So it's been a great experience.
Wow, that sounds amazing. And Dr. Alvarez, you're going to be starting an interventional cardiology fellowship in 2024 at Summa Health. Can you tell us a little bit about what your goals are for this?
Yeah, so I'm going to be doing a 1-year interventional cardiology fellowship. So interventional cardiology is the group of doctors that really take care of coronary artery disease from the procedural perspective. So when you hear someone's having a heart attack and they get brought to, a lab and they get a stent placed, the interventional cardiologist is the one that's doing that procedure. So I'm someone that's always liked procedures. I like being hands-on. I don't enjoy being in the office all the time. So I'm really excited that, I get to do this role. The other thing interventional cardiologists get trained to do is valve replacements. So there are patients where surgery isn't a great option for them because, they're too high risk or they've had surgery previously. So redoing surgery would be difficult. So there are procedures in place to replace valves by going in through the arteries and veins in the legs so that you don't have to cut someone's chest open. So I'll be able to do that as well. So yeah, so really my goal is for this year coming up is to just work as hard as possible to get as, strong and as good in these procedures as I can. A year seems like a long time, but it's really not. So it's going to be challenging, and I'm just hoping I can focus and just get as technically good as I can.
Wow, and it sounds like you're doing some really amazing and important work. And you didn't actually start out in cardiology. You completed your internal medicine residency at Mercy Catholic Medical Center, I believe in Pennsylvania. What were some of the highlights of your residency there?
So yeah, internal medicine is the first step to getting a cardiology fellowship or an interventional cardiology fellowship. Mercy Catholic Medical Center is actually just right outside of Philadelphia in Pennsylvania. It is a community hospital. So I feel like the best part of there was how I was able to build my confidence in my own decision-making skills. When you first come out of med school and you first start residency, you don't feel like you know anything. You feel like you've been in school for 4 years, but the first time a nurse comes up to you with a question, you're like, no, I have no idea. And, you run to your senior resident or you run to your attending and you're asking questions. But I think the best part about where I did residency was that over the years, you really did get more autonomy and you were able to make more decisions on your own and kind of be watched more from the outside. Like someone was checking on you, but you didn't necessarily know. They kind of made it seem like you were completely in control. And, I think that raised a lot of confidence because I was making decisions on my own. I had COVID thrown in there during residency, so that kind of put like a knife in everything and kind of made everything change pretty quickly. But, at the end of the day, I think that was the best part, being able to make decisions on my own and feel like I was being given the opportunity to, make decisions, sometimes make mistakes and learn from them and grow that way.
Okay, great. And getting back to your medical education, what made you decide on attending UMHS over other med schools?
So I had an interesting pathway. So I actually never applied to school in the United States. I only applied to Caribbean med schools. The reason why I ultimately chose UMHS was actually I went in person for my interview. I'm originally from New Jersey, so UMHS headquarters in New York City was a very close train ride away. So I went with my mother to the interview at headquarters in the city. And that interview was just so different than any other interview I had been on. I really felt like the administration really cared about you as an individual and not just your test scores and how you did academically. They asked a lot of questions about myself, my hobbies, why I wanted to do what I was doing, whereas a lot of other places focused more on grades and academic accomplishments. And I just felt that UMHS cared more about the overall person rather than just numbers and statistics. And that for me was very important. I also knew of, the fact that they had opened Ross and that was successful, and there were successful graduates from there because, back when I was interviewing, UMHS was fairly more new.
Right.
So, a lot of people had paused with that, but knowing that they had been successful previously, I didn't feel any hesitation. I also knew a current student who was there, and I talked to him, and I was kind of sold. So once I got accepted, I didn't hesitate to say yes.
Okay, very great. And is there anything specific about your medical education at UMHS that's really helped you accomplish your goals and become the doctor that you are today?
So I think the greatest thing about UMHS is its professors. They are absolutely incredible people. They really want you to succeed and they really root for you. Their doors are always open. If you ever have a question, you can just walk into their office, shoot them an email, ask them in class. The other great strength is the smaller class sizes. So you don't feel like a number. Your professors know you. The environment never felt like a place where people were competing. Everyone kind of rallied around each other, would make study groups. Everyone roots for each other. Like, we all want everybody to succeed. And I think that's a great strength because when everyone's lifting each other up, it makes everything a lot easier, especially knowing that you're so far from your family and you can't go home and see your friends and everything. Having an environment that is uplifting you is really great. But the professors put so much of their time and energy. You can tell that they all really love what they're doing and they all really genuinely want to be helping you and want to be there. It just made it so much easier to succeed, knowing that I could go up to a teacher at any point and ask a question and it would be answered immediately.
Okay, great. And is there anything you'd like to say to those current or prospective students out there, not only possibly considering UMHS, but looking at possibly a career in cardiology or internal medicine? I mean, what would you say to the current and prospective students out there?
I would say that UMHS is definitely a great place to go if you're looking to grow, looking to learn. It really is a great place. The island itself, is great. And in terms of internal medicine, there is such a great need for internal medicine physicians. You will have no problems finding a job. If you are someone that likes to make connections with patients, likes to have a relationship with patients, internal medicine is a great place to start. If you choose to specialize in anything, I'm kind of partial, but cardiology is a great field. You can really make a difference in people's lives. You don't have to be someone that wants to do procedures in order to make that difference. There's a huge need for people in preventative cardiology, in heart failure specialists. And again, cardiology is a specialty where you make connections with patients and you see patients throughout their lives in completely different stages of their lives. You may see them one day in the emergency department having a heart attack, and 10 years later, you're talking, about how they're getting married and having kids or having grandkids. So you get that longevity with patients, and you also get to make an immediate impact. I think the heart's the best organ physiologically to study. It just makes sense. So there's that too, but you definitely get to make connections with people, which it is a great thing in my opinion.
Okay, great. And Dr. Alvarez, is there anything else that you'd like to add that we haven't covered today?
No, I mean, I'm just thankful that, I was able to attend UMHS and I was able to achieve what I was able to achieve. Everyone there, the professors that I still am in communication with on social media, they're still celebrating our successes, even when we're long gone. You know, I graduated in 2017, and there are still professors that follow me on Facebook. And anytime that I've met a new milestone, they're messaging me and, you know, encouraging me. So the relationships don't end once you graduate. The alumni, like, it's an amazing community.